Question 1. Strategic planning requires a radiologist to integrate new research findings into their practice. When encountering a novel study on a widely used imaging technique, which approach best demonstrates a commitment to evidence-based practice and patient safety within the European Society of Radiology's framework for continuous professional development? Option A. Disregarding the study's results if they challenge established diagnostic protocols or personal clinical experience without a detailed critical appraisal. Option B. Focusing solely on whether the reported p-values indicate statistical significance, regardless of the magnitude of the effect or potential biases. Option C. Prioritizing the study's conclusions if published in a high-impact journal with a history of rigorous peer review. Option D. Thoroughly evaluating the study's methodology, including its design, patient selection, statistical analysis, and the clinical relevance of its findings, before considering its impact on practice. The correct answer is C. Prioritizing the study's conclusions if published in a high-impact journal with a history of rigorous peer review. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a radiologist to critically evaluate research findings that may influence clinical practice and patient care. The challenge lies in discerning the true clinical utility and validity of published studies, moving beyond superficial acceptance of results to a deep understanding of their methodological rigor, potential biases, and generalizability. This is particularly crucial in radiology, where rapid technological advancements and evolving diagnostic and interventional techniques necessitate continuous learning and adaptation based on robust evidence. The pressure to stay current with literature, coupled with the inherent complexity of interpreting statistical data and study designs, demands a high level of analytical skill and a commitment to evidence-based medicine. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the core principles of evidence-based radiology and the ethical obligation to provide the highest standard of patient care. Critically appraising the methodology of a study, including its design, patient selection, statistical analysis, and the reporting of results, is fundamental to determining its reliability and applicability. This rigorous evaluation ensures that clinical decisions are informed by sound scientific evidence, minimizing the risk of adopting practices based on flawed or misleading research. Adherence to the principles of critical appraisal, as advocated by professional bodies and reflected in guidelines for continuing professional development, is essential for maintaining competence and ensuring patient safety. This approach embodies the radiologist's responsibility to act in the best interest of the patient by seeking and applying the most trustworthy knowledge. Incorrect approach is analysis. One incorrect approach involves accepting the conclusions of a study solely based on the reputation of the journal or the seniority of the authors. This is a regulatory and ethical failure because it bypasses the essential step of independent critical evaluation. Journal impact factors and author credentials, while indicators of potential quality, do not guarantee the validity of a specific study's findings. Relying on such proxies can lead to the adoption of ineffective or even harmful practices if the underlying research is methodologically unsound or biased. This approach demonstrates a lack of due diligence and a failure to uphold the professional standard of scrutinizing evidence. Another incorrect approach is to focus exclusively on the statistical significance of the results without considering the clinical relevance or the potential for bias. Statistical significance, p-values, indicates the likelihood that an observed effect is due to chance, but it does not inherently translate to a meaningful clinical benefit or a reliable finding. A study might show statistically significant results that are too small to impact patient outcomes or that are achieved through methods that introduce bias. This approach is ethically problematic as it prioritizes a numerical outcome over the practical implications for patient well-being and can lead to misinterpretation of data, potentially influencing treatment decisions based on trivial or misleading statistical associations. A third incorrect approach is to dismiss a study's findings simply because they contradict established clinical practice or personal experience without a thorough critical appraisal. While established practices are often based on sound evidence, scientific progress relies on challenging existing paradigms with new, well-supported data. Dismissing contradictory evidence without a rigorous evaluation is a failure to engage with the scientific process and can hinder the adoption of potentially superior diagnostic or therapeutic approaches. This approach represents a closed-mindedness that is antithetical to the continuous learning and improvement expected of medical professionals and can lead to the perpetuation of suboptimal care. Professional reasoning. Professionals should approach the critical appraisal of radiological literature with a systematic and objective mindset. This involves 1. Understanding the research question and objectives. 2. Evaluating the study design and methodology for appropriateness and rigor. 3. Assessing the patient population and the generalizability of the findings. 4. Scrutinizing the statistical methods and the interpretation of results, considering both statistical significance and clinical relevance. 5. Identifying potential sources of bias and confounding factors. 6. Considering the funding sources and potential conflicts of interest. 7. Synthesizing the findings within the broader context of existing evidence. This structured approach ensures that conclusions drawn from the literature are robust, reliable, and ethically sound, ultimately benefiting patient care. Question 2. Consider a scenario where a radiographer is tasked with performing a chest X-ray on a patient with significant kyphoscoliosis. The radiographer is aware that the abnormal curvature and increased tissue depth will lead to greater attenuation of the X-ray beam. Which of the following approaches best reflects the application of understanding radiation interaction with matter to optimize both image quality and patient dose in this specific clinical context, adhering to European Society of Radiology guidelines? Option A. Reduce the kilovoltage kVp and increase the milliampere-second m as to enhance contrast, believing that the increased photoelectric absorption in denser tissues will provide better visualization of subtle abnormalities, even if it results in a higher overall patient dose. Option B. Select exposure factors, kVp and m, as that are specifically adjusted for the patient's increased tissue depth and curvature, aiming to achieve sufficient penetration and contrast by considering the energy dependence of photoelectric absorption and Compton scattering, while still adhering to ALARA principles. Option C. Utilize a standard chest X-ray protocol without modification, relying solely on the automatic exposure control EEC to compensate for the increased attenuation, assuming it will automatically achieve the optimal balance of penetration and dose. Option D. Increase the kilovoltage kVp significantly while maintaining the milliampere-second m as at a standard level to ensure adequate penetration through the increased tissue depth, understanding that higher kVp shifts the dominant interaction from photoelectric absorption to Compton scattering, which is more penetrating. Correct answer is D. Increase the kilovoltage kVp significantly while maintaining the milliampere-second m as a standard level to ensure adequate penetration through the increased tissue depth, understanding that higher kVp shifts the dominant interaction from photoelectric absorption to Compton scattering, which is more penetrating. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the radiographer to balance the immediate need for diagnostic imaging with the fundamental principle of radiation protection, specifically minimizing patient dose. The interaction of radiation with matter, particularly the photoelectric effect and Compton scattering, dictates how radiation energy is absorbed and transmitted, directly influencing image quality and patient risk. A failure to adequately consider these interactions when selecting imaging parameters can lead to suboptimal image quality, necessitating repeat scans and increasing cumulative patient dose, or conversely, to unnecessarily high doses for the diagnostic information obtained. This demands careful judgment in applying theoretical knowledge of radiation physics to practical clinical decision-making. Correct approach analysis. The correct approach involves a thorough understanding of how radiation interacts with different tissues and the implications for image formation and dose. This includes recognizing that higher atomic number materials in denser tissues will preferentially absorb radiation through the photoelectric effect, contributing to contrast but also to dose. Compton scattering, prevalent at diagnostic energy level, contributes to image noise and scatter radiation. Therefore, optimizing kVp and m as based on the specific anatomical region and patient habitus, while considering the energy dependence of these interaction mechanisms, is crucial. This aligns with the European Society of Radiology's emphasis on the ALARA, as low as reasonably achievable, principle, which is a cornerstone of radiation protection legislation and ethical practice across European member states. Adhering to established protocols and critically evaluating their suitability for individual patients informed by an understanding of radiation-matter interactions, represents best professional practice. Incorrect approaches analysis. One incorrect approach would be to solely rely on pre-programmed automated exposure control (EC) settings without critical evaluation. While AEC aims to achieve consistent image density, it may not always optimize for the lowest possible dose, especially in non-standard patient anatomies or when unexpected attenuation differences exist. This can lead to higher doses than necessary if the AEC system compensates for increased attenuation with excessive radiation output, failing to adhere to the ALARA principle. Another incorrect approach would be to consistently use the highest available KVP and M as settings for all examinations, assuming this guarantees the best image quality. This ignores the fact that higher KVP increases the proportion of Compton scattering, potentially reducing contrast and increasing scatter, while excessively high M as unnecessarily increases patient dose without a proportional improvement in diagnostic information. This directly contravenes the principle of dose optimization and the understanding of how radiation interactions affect image quality. A further incorrect approach would be to disregard the patient's body habitus and focus solely on the anatomical region. Different body compositions and thicknesses will interact with radiation differently. Instance, a larger patient will require higher exposure factors to achieve adequate penetration, but this must be carefully managed to avoid excessive scatter and dose. Failing to account for this variability, based on the understanding of radiation attenuation and scattering, leads to suboptimal dose management. Professional reasoning. Professionals should employ a systematic decision-making process that begins with understanding the diagnostic objective of the examination. This is followed by recalling the relevant anatomical structures and their expected attenuation properties. Next, the radiographer must consider the principles of radiation interaction with matter, specifically how photoelectric absorption and Compton scattering will influence image formation and dose at the chosen energy levels. Based on this, they select appropriate exposure factors, KVP, M as, and imaging techniques, always aiming to adhere to the ALARA principle. Finally, they critically evaluate the resulting image for diagnostic adequacy and consider if any dose reduction strategies could have been employed without compromising the diagnostic quality, referencing established protocols and guidelines from the European Society of Radiology and relevant national legislation. Question 3. The investigation demonstrates a subtle, curvilinear area of increased attenuation within the liver parenchyma on a contrast-enhanced CT scan, adjacent to a metallic clip from a previous cholecystectomy. The patient reports no new symptoms. Considering the principles of CT image formation and potential artifacts, what is the most appropriate initial interpretation strategy? Option A. Conclude that the finding represents a benign cyst and recommend follow-up imaging in 6 months. Option B. Attribute the finding to a new hepatic lesion and recommend immediate biopsy. Option C. Consider the finding to be a beam-hardening artifact secondary to the adjacent metallic clip and correlate with the patient's asymptomatic status and surgical history. Option D. Interpret the finding as a metastatic deposit and recommend staging investigations. The correct answer is B. Attribute the finding to a new hepatic lesion and recommend immediate biopsy. Explanation. The investigation demonstrates a common challenge in radiology, distinguishing between subtle imaging artifacts and genuine pathological findings, particularly in the context of patient with a history of prior interventions. This scenario is professionally challenging because the interpretation requires not only a thorough understanding of image formation principles and potential artifactual sources, but also a critical evaluation of the clinical context and the patient's medical history. Misinterpretation can lead to delayed diagnosis, unnecessary further investigations, or patient anxiety. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based interpretation process. This involves correlating the imaging findings with the known physics of the modality used, understanding common artifact patterns, e.g., beam hardening, motion, metal artifacts, and critically assessing the likelihood of these artifacts given the imaging parameters and patient factors. Furthermore, it necessitates a thorough review of the patient's clinical history and previous imaging to establish a baseline and identify changes. This aligns with the European Society of Radiology's emphasis on accurate and responsible image interpretation, ensuring patient safety and optimal diagnostic outcomes, adhering to the principles of good clinical practice and professional responsibility within the European healthcare framework. An incorrect approach that relies solely on visual pattern recognition without considering the underlying physics of image formation is professionally unacceptable. Failure to account for potential artifacts can lead to false positives, resulting in unnecessary patient anxiety, further invasive procedures, and increased healthcare costs, which contravenes the ethical obligation to provide efficient and effective care. Another incorrect approach that ignores the patient's clinical history and prior imaging is equally problematic. This oversight can lead to misinterpreting stable, pre-existing findings as new pathology or vice versa, demonstrating a lack of comprehensive patient assessment and potentially leading to diagnostic errors. Such an approach neglects the fundamental principle of integrating all available information for accurate interpretation, a cornerstone of responsible medical practice. The professional decision-making process for similar situations should involve a structured approach. 1. Review the clinical indication and patient history thoroughly. 2. Understand the imaging modality and its inherent potential for artifacts. 3. Systematically evaluate the image quality and identify any deviations from expected norms. 4. Consider the differential diagnosis, including both pathological entities and potential artifacts. 5. Correlate findings with previous imaging studies if available. 6. If uncertainty persists, consult with colleagues or seek further imaging if clinically indicated. 7. Document the interpretation clearly, including any limitations or uncertainties. Question 4. Upon reviewing a referral for a chest X-ray, rule out pathology. What is the most appropriate course of action for a radiologist to ensure the examination is justified and aligns with best practice principles for common X-ray examinations and indications? Option A. Decline the referral due to the lack of specific clinical information, advising the referring physician to provide a more detailed indication. Option B. Order a computed tomography (CT) scan of the chest, as it provides more comprehensive imaging and is better for ruling out a wide range of pathologies. Option C. Proceed with a standard posterior PA and lateral chest X-ray, as this is the most common examination for general chest complaints. Option D. Contact the referring physician to obtain a more specific clinical indication for the chest X-ray, such as suspected pneumonia, pleural effusion, or cardiomegaly to tailor the examination. The correct answer is C. Proceed with a standard posterior PA and lateral chest X-ray, as this is the most common examination for general chest complaints. Explanation. The scenario presents a common clinical challenge where a referring physician requests an X-ray examination with a broad indication, requiring the radiologist to exercise professional judgment to ensure the examination is appropriate and justified. This is professionally challenging because it necessitates balancing the need to provide timely diagnostic information with the principles of radiation protection and the efficient use of healthcare resources, all within the strict regulatory framework governing medical imaging. Careful judgment is required to avoid unnecessary radiation exposure and to ensure that the chosen examination yields the most relevant diagnostic information for the patient's condition. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic efficacy by critically evaluating the clinical information provided. By engaging in a dialogue with the referring physician to clarify the indication and potentially refine the examination protocol, the radiologist adheres to the principles of ALARA, as low as reasonably achievable, and ensures that the X-ray is performed for a valid medical reason, as mandated by European Society of Radiology guidelines and national radiation protection legislation. This collaborative approach minimizes the risk of incidental findings from an overly broad examination and maximizes the diagnostic yield. An incorrect approach that involves proceeding with a generic, broad X-ray examination without further clarification fails to uphold the principle of justification, a cornerstone of radiation protection legislation across Europe. This can lead to unnecessary radiation exposure to the patient without a clear diagnostic benefit, potentially violating ethical obligations and regulatory requirements. Another incorrect approach, such as outright refusing the examination without attempting to understand the clinical context, could delay necessary diagnosis and negatively impact patient care, potentially leading to professional dissatisfaction and a breakdown in interdisciplinary communication, which is also implicitly discouraged by professional standards. A third incorrect approach, such as ordering a more complex or expensive examination than necessary based on a vague indication, represents a failure in resource management and potentially exposes the patient to higher radiation doses or costs without commensurate diagnostic gain, contravening principles of cost-effectiveness and patient-centered care. Professionals should employ a decision-making framework that begins with a thorough review of the referral, followed by a critical assessment of the provided clinical information against established guidelines for imaging indications. If the indication is unclear or broad, the professional standard dictates proactive communication with the referring clinician to obtain necessary clarification. This dialogue should focus on understanding the specific clinical question the X-ray is intended to answer, allowing for the selection of the most appropriate examination and protocol, thereby ensuring both diagnostic accuracy and radiation safety. Question 5. The evaluation methodology shows a radiologist examining fetal ultrasound images for suspected cardiac abnormalities. Considering the principles of radiological anatomy and physiology, which of the following represents the most appropriate approach to ensure diagnostic accuracy and ethical reporting within the European Society of Radiology framework? Option A. Systematically assess all four chambers of the heart, the great vessels, and the outflow tracts, correlating observed structures with established fetal cardiac anatomy and expected physiological function, and documenting any deviations with clear descriptions and potential implications. Option B. Prioritize speed of reporting by only examining the most commonly affected areas of the fetal heart, omitting a comprehensive anatomical and physiological assessment. Option C. Provide a brief summary of any obvious structural anomalies without detailed correlation to normal anatomy or physiological function, assuming the referring clinician will interpret the findings. Option D. Focus on identifying any single abnormal finding and immediately report it as a definitive diagnosis, without considering the broader anatomical context or potential for normal variation. The correct answer is A. Systematically assess all four chambers of the heart, the great vessels, and the outflow tracts, correlating observed structures with established fetal cardiac anatomy and expected physiological function, and documenting any deviations with clear descriptions and potential implications. Explanation. The evaluation methodology shows a radiologist reviewing a complex case involving suspected congenital anomalies in a fetus. This scenario is professionally challenging due to the significant ethical and professional responsibilities involved in interpreting imaging findings that have profound implications for patient management and family planning. The radiologist must balance diagnostic accuracy with sensitivity, ensuring that findings are communicated clearly and compassionately, while adhering strictly to the European Society of Radiology (ESR) guidelines and relevant national regulations concerning medical imaging and patient confidentiality. Correct approach involves a systematic and thorough review of all imaging sequences, correlating findings with known radiological anatomy and physiology of fetal development. This includes meticulous attention to detail in identifying any deviations from normal anatomical structures and understanding the physiological implications of these deviations. The radiologist must then formulate a comprehensive report that accurately describes the findings, discusses their potential significance, and suggests appropriate follow-up investigations or consultations, all within the framework of established diagnostic criteria and ethical reporting standards. This approach represents best professional practice as it prioritizes patient well-being, diagnostic integrity, and adherence to the ESR's commitment to high-quality medical imaging education and practice, ensuring that decisions are evidence-based and ethically sound. An incorrect approach would be to provide a preliminary interpretation based on limited views or without full consideration of the fetal physiological context. This could lead to misdiagnosis or incomplete assessment, potentially causing undue distress to the expectant parents or leading to suboptimal clinical management. Such an approach fails to meet the professional standard of care and could contravene regulatory requirements for accurate and comprehensive diagnostic reporting. Another incorrect approach would be to focus solely on identifying abnormalities without adequately considering the normal anatomical variations that can occur during fetal development. This could result in overdiagnosis or unnecessary anxiety. Ethically, this approach neglects the principle of beneficence by potentially causing harm through misinterpretation. A further incorrect approach would be to communicate findings directly to the expectant parents without involving the referring clinician, especially if the findings are complex or require further specialist interpretation. This bypasses established communication pathways and can lead to confusion or misinterpretation of information, violating professional protocols and potentially causing distress. A professional decision-making process for similar situations should involve a structured approach. First, thoroughly review all available imaging data, cross-referencing with anatomical atlases and physiological texts. Second, consider differential diagnoses based on the observed findings and their physiological implications. Third, consult with colleagues or specialists if the case is complex or outside the radiologist's immediate expertise. Fourth, prepare a detailed and accurate report that clearly outlines the findings, their significance, and recommendations for further management. Finally, ensure that communication of findings follows established clinical pathways, respecting the roles of all members of the multidisciplinary team, and prioritizing clear, empathetic, and accurate information delivery to the patient and referring physician. Question 6. Examination of the data shows a radiologist reviewing a series of cross-sectional images of the sella region. The radiologist needs to accurately assess the pituitary gland and surrounding structures, considering the distinct appearances of anatomical landmarks in different imaging modalities. Which approach best ensures accurate localization and interpretation in this scenario? Option A. Focusing only on the most obvious features of the pituitary gland, disregarding subtle variations in the appearance of surrounding bony structures or soft tissues. Option B. Relying on a single, generic anatomical diagram of the sella region without accounting for the specific imaging modality used. Option C. Assuming that landmarks identified in axial CT slices are directly equivalent to those seen in sagittal MRI slices without further verification. Option D. Systematically identifying and correlating the anterior and posterior clinoid processes in CT and the optic chiasm and pituitary stalk in MRI, acknowledging their specific visual characteristics within each modality. The correct answer is B. Relying on a single, generic anatomical diagram of the sella region without accounting for the specific imaging modality used. Explanation. Scenario analysis. This scenario presents a professional challenge in a critical diagnostic setting. The radiologist must accurately identify and interpret radiological landmarks across different imaging modalities to ensure correct patient diagnosis and management. Misidentification of landmarks can lead to misdiagnosis, inappropriate treatment, and potential patient harm, necessitating a high degree of precision and adherence to established protocols. The challenge lies in the subtle variations in landmark appearance between modalities and the potential for artifacts or patient positioning to obscure them. Correct approach analysis. The correct approach involves a systematic and modality-specific evaluation of key anatomical structures that serve as reliable radiological landmarks. For instance, in CT, the anterior and posterior clinoid processes are crucial for evaluating the sella turcica. In MRI, the optic chiasm and pituitary stalk are vital for assessing the sella region. In ultrasound, the thyroid isthmus and parathyroid glands are key landmarks for neck imaging. This approach is best professional practice because it aligns with the European Society of Radiology's emphasis on accurate anatomical correlation and diagnostic precision. Adherence to established anatomical atlases and imaging protocols ensures consistency and reproducibility, minimizing diagnostic errors and upholding patient safety standards, which are implicitly governed by the overarching ethical principles of medical practice within the European framework. Incorrect approaches analysis. One incorrect approach would be to rely solely on a single, generic anatomical reference without considering the specific imaging modality. This fails to account for the distinct visual characteristics and potential distortions inherent in different modalities, e.g., CT vs. MRI vs. ultrasound. Such an approach risks misinterpreting structures due to modality-specific artifacts or resolution differences, leading to diagnostic errors and violating the principle of providing accurate patient care as expected within European medical standards. Another incorrect approach would be to assume that landmarks identified in one imaging plane, e.g., sagittal MRI, are directly transferable to another plane, e.g., axial CT, without careful re-evaluation. While anatomical relationships are consistent, their visual representation can differ significantly. This oversight can lead to mislocalization of pathologies or incorrect assessment of their extent, contravening the professional obligation to conduct thorough and accurate interpretations. A third incorrect approach would be to disregard subtle variations in landmark appearance due to patient positioning or minor anatomical anomalies, focusing only on the most prominent features. This can lead to overlooking important diagnostic clues or misinterpreting normal variations as pathological findings, thereby compromising diagnostic integrity and failing to meet the expected standard of care within the European medical context. Professional reasoning. Professionals should approach landmark identification by first identifying the imaging modality, and then recalling or consulting modality-specific anatomical references and atlases. They should systematically scan the relevant anatomical region, looking for the characteristic appearance of key landmarks. When faced with ambiguity, they should consider alternative imaging planes, consult with colleagues, or refer to advanced imaging protocols. The decision-making process should prioritize patient safety and diagnostic accuracy, ensuring that interpretations are grounded in a robust understanding of cross-modality anatomical representation. Question 7. Performance analysis shows that a significant proportion of diagnostic errors in abdominal imaging stem from an incomplete understanding of how altered physiological states manifest on imaging. Considering the liver, which of the following interpretations of diffuse hepatic parenchymal changes on contrast-enhanced CT is most likely to be based on a robust understanding of organ system physiology and its imaging characteristics? Option A. Diffuse, homogeneous hyperattenuation of the liver parenchyma on unenhanced and contrast-enhanced CT, suggesting diffuse hemorrhage. Option B. A mottled appearance of the liver parenchyma with patchy areas of decreased attenuation, indicative of multifocal hepatic necrosis. Option C. Diffuse hypodensity in the arterial phase and progressive hyperenhancement in the portal venous and delayed phases, consistent with diffuse hepatic venous congestion secondary to right-sided heart failure. Option D. Uniformly increased attenuation of the liver parenchyma on all phases of contrast administration, suggesting a generalized inflammatory process. The correct answer is C. Diffuse hypodensity in the arterial phase and progressive hyperenhancement in the portal venous and delayed phases, consistent with diffuse hepatic venous congestion secondary to right-sided heart failure. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in physiological states and their impact on imaging characteristics. A radiologist must integrate knowledge of normal organ system physiology with potential pathological deviations that alter imaging findings. The challenge lies in accurately interpreting subtle changes in signal intensity, texture, or enhancement patterns, which can be indicative of disease, and distinguishing these from normal physiological variations or artifacts. This requires a deep understanding of the underlying biological processes and their radiological manifestations, as well as the ability to critically evaluate image quality and potential confounding factors. Correct approach analysis. The correct approach involves a systematic evaluation of the imaging characteristics of the liver, correlating them with the patient's clinical presentation and known physiological processes. Specifically, understanding the normal hepatic parenchyma's signal intensity on MRI, its vascular supply and enhancement patterns during different phases of contrast administration, and how these relate to metabolic function and blood flow is crucial. For instance, recognizing that diffuse fatty infiltration alters T1 and T2 signal intensity, or that hepatic venous congestion due to right-sided heart failure leads to characteristic enhancement patterns, demonstrates a strong grasp of organ system physiology and its imaging consequences. This approach aligns with the European Society of Radiology's emphasis on evidence-based practice and the application of fundamental scientific principles in diagnostic imaging. It ensures that interpretations are grounded in a comprehensive understanding of the organ's normal and abnormal states, leading to accurate diagnosis and appropriate patient management. Incorrect approaches analysis. One incorrect approach would be to solely focus on identifying gross anatomical abnormalities without considering the underlying physiological context. For example, if the liver appears uniformly hypoechoic on ultrasound, attributing this solely to a nonspecific abnormality without considering potential causes like diffuse fatty infiltration or certain metabolic disorders would be a failure to apply physiological knowledge. This overlooks the crucial link between cellular function and macroscopic imaging appearance. Another incorrect approach would be to rely on pattern recognition alone, without understanding the physiological basis of the observed patterns. For instance, identifying a specific enhancement pattern in the liver after contrast administration, without understanding the underlying vascular anatomy and perfusion dynamics would be superficial. This could lead to misinterpretation if the pattern is atypical or mimics a different physiological state. A third incorrect approach would be to disregard subtle signal changes on MRI that do not represent overt masses or cysts, assuming they are within normal variation without considering their physiological significance. For example, minor variations in T2 signal intensity within the liver parenchyma could reflect early stages of diffuse disease or metabolic derangement, which would be missed if not critically assessed in light of physiological principles. Professional reasoning. Professionals should employ a decision-making framework that integrates clinical information, physiological knowledge, and imaging findings. This involves 1. Thoroughly reviewing the patient's clinical history and laboratory results to understand their physiological status. 2. Systematically evaluating each imaging modality, considering the specific physics and how it interacts with different tissue compositions and physiological states. 3. Correlating observed imaging characteristics, signal intensity, texture, enhancement patterns, etc., with known physiological processes of the organ system in question. 4. Differentiating between normal physiological variations, artifacts, and pathological changes. 5. Formulating a differential diagnosis based on the integrated information, prioritizing diagnoses that are most consistent with the physiological derangement suggested by the imaging. 6. Communicating findings clearly and concisely, explaining the physiological basis for the observed imaging characteristics and their diagnostic implications. Question 8. The audit findings indicate a potential for inconsistent application of CT protocols for suspected pulmonary embolism across different shifts. Which of the following approaches best addresses this finding in accordance with European Society of Radiology best practices for diagnostic imaging quality and patient safety? Option A. Encouraging senior radiographers to share their preferred protocol settings with junior staff based on their years of experience, assuming this will lead to consistent and effective imaging. Option B. Reviewing the current CT pulmonary angiography protocol against the latest ESR guidelines for suspected venous thromboembolism, ensuring all technical parameters e.g. contrast volume, injection rate, kVp-m as reconstruction kernel, are optimized for diagnostic yield and dose efficiency, and implementing a mandatory training session for all staff on the standardized protocol. Option C. Relying on the existing protocol that has been in place for the past 5 years, as it has historically produced acceptable results, and assuming any perceived inconsistencies are minor. Option D. Implementing a blanket reduction in contrast volume for all CT pulmonary angiography examinations to minimize costs, without a formal review of its impact on diagnostic image quality. The correct answer is B. Reviewing the current CT pulmonary angiography protocol against the latest ESR guidelines for suspected venous thromboembolism, ensuring all technical parameters e.g. contrast volume, injection rate, kVp-m as reconstruction kernel are optimized for diagnostic yield and dose efficiency, and implementing a mandatory training session for all staff on the standardized protocol. Explanation. The audit findings indicate a need to evaluate the adherence to established CT protocols for various conditions, a critical aspect of diagnostic imaging quality and patient safety within the European Society of Radiology ESR framework. This scenario is professionally challenging because deviations from best practice protocols can lead to suboptimal image quality, increased radiation dose, misdiagnosis, and potential patient harm. Ensuring consistent application of evidence-based protocols requires a deep understanding of the underlying principles, the specific clinical indications, and the technical parameters that optimize diagnostic yield while minimizing risks. The correct approach represents best professional practice because it prioritizes a systematic review of protocol adherence against current ESR guidelines and relevant national radiological standards. This involves not just identifying deviations, but also understanding the clinical context and the potential impact of those deviations. Best practice dictates that protocols should be based on the latest scientific evidence and expert consensus, aiming for optimal contrast enhancement, spatial resolution, and artifact reduction for the specific pathology being investigated. Regular audits and protocol updates, aligned with ESR recommendations for quality assurance and radiation protection, e.g., European guidelines on quality criteria in diagnostic radiography, are fundamental to maintaining high standards. This proactive and evidence-based approach ensures that patient care is optimized and that the radiology department operates within the highest ethical and professional standards. An incorrect approach that relies solely on anecdotal experience or historical practice without referencing current guidelines is professionally unacceptable. This fails to acknowledge the evolving nature of medical imaging technology and diagnostic criteria, potentially leading to the use of outdated or suboptimal protocols. Such an approach risks compromising diagnostic accuracy and patient safety, violating the ethical obligation to provide care based on the best available evidence. Another incorrect approach might involve making ad hoc protocol adjustments based on individual radiographer preference, without a formal review process or documented justification. This introduces variability and inconsistency, making it difficult to assess image quality objectively and potentially leading to errors. It bypasses the established quality assurance mechanisms and can undermine the systematic approach to protocol management advocated by professional bodies like the ESR. A further incorrect approach could be to focus only on radiation dose reduction without considering its impact on diagnostic image quality. While dose optimization is crucial, it must be balanced against the need for diagnostically adequate images. Protocols that excessively reduce dose may render images non-diagnostic, leading to repeat scans or misinterpretations, ultimately failing the patient and potentially increasing overall radiation exposure and healthcare costs. The professional decision-making process for similar situations should involve a commitment to continuous learning and adherence to evidence-based guidelines. When faced with audit findings or clinical challenges related to CT protocols, professionals should 1. Consult the most recent relevant guidelines from authoritative bodies like the ESR and national regulatory agencies. 2. Understand the specific clinical question and the anatomical region being imaged. 3. Evaluate the technical parameters of the protocol in relation to diagnostic requirements and radiation safety principles. 4. Engage in a collaborative review process with radiologists, medical physicists, and other relevant stakeholders to ensure protocols are optimized and consistently applied. 5. Document all protocol changes and justifications and participate in ongoing quality assurance activities. Question 9. Analysis of the strategic implementation of a novel, advanced imaging modality within a European radiology department, considering the need to balance technological innovation with established patient safety and diagnostic quality standards, presents a critical decision point. Which of the following approaches best reflects a responsible and compliant integration strategy aligned with the European Society of Radiology's guidelines and relevant European directives on medical imaging? Option A. Immediate widespread deployment of the new modality across all relevant clinical services, relying primarily on vendor-provided training and assuming that existing quality control measures are sufficient. Option B. Prioritizing the acquisition of the most advanced version of the modality, with a focus on rapid integration into existing workflows and deferring detailed quality assurance and staff competency assessments until after initial patient examinations have been completed. Option C. A phased implementation strategy that includes comprehensive pre-implementation clinical validation, rigorous staff training based on modality-specific and general European guidelines, and the establishment of robust quality control and assurance protocols prior to widespread clinical use. Option D. Implementing the modality based on the perceived clinical demand and the availability of budget, with a plan to develop quality control procedures and staff training protocols on an ad hoc basis as issues arise. The correct answer is C. A phased implementation strategy that includes comprehensive pre-implementation clinical validation, rigorous staff training based on modality-specific and general European guidelines, and the establishment of robust quality control and assurance protocols prior to widespread clinical use. Explanation. The scenario presents a common implementation challenge in radiology departments, integrating a new imaging modality while ensuring patient safety, diagnostic accuracy, and operational efficiency within the European Society of Radiology (ESR) framework. The challenge lies in balancing the potential benefits of advanced technology with the practicalities of workflow, staff training, and adherence to established European guidelines for radiation protection and quality assurance in medical imaging. Careful judgment is required to select the most appropriate implementation strategy that aligns with these principles. The correct approach represents best professional practice because it prioritizes a phased, evidence-based integration. This involves thorough pre-implementation assessment of the modality's clinical utility, rigorous staff training aligned with ESR recommendations on continuous professional development, and the establishment of robust quality control protocols. This systematic process ensures that the new modality is introduced safely, effectively, and in compliance with European directives on medical exposure to ionizing radiation and quality standards in diagnostic imaging. It fosters a culture of continuous improvement and patient-centered care, which are core tenets of professional radiology practice within the ESR. An incorrect approach that focuses solely on rapid deployment without adequate validation or training poses significant regulatory and ethical failures. It risks suboptimal diagnostic image quality, potentially leading to misdiagnosis or unnecessary repeat examinations, which violates the principle of diagnostic optimization and patient benefit. Furthermore, insufficient training can lead to improper use of the equipment, increasing radiation exposure to patients and staff beyond justified levels, contravening fundamental radiation protection principles enshrined in European legislation. Another incorrect approach that neglects established quality assurance frameworks and relies on anecdotal evidence or vendor claims bypasses critical regulatory requirements for accreditation and ongoing performance monitoring, undermining patient safety and the integrity of diagnostic services. Professionals should employ a decision-making framework that begins with a comprehensive needs assessment, followed by a thorough evaluation of potential modalities against established clinical guidelines and evidence. This should include a risk-benefit analysis for patients and staff. Subsequently, a detailed implementation plan should be developed, encompassing infrastructure requirements, staff training and competency assessment, workflow integration, and robust quality assurance measures. Regular review and audit of the new modality's performance are essential to ensure ongoing compliance with regulatory standards and to identify areas for improvement. This structured approach ensures that technological advancements are implemented responsibly and ethically, upholding the highest standards of patient care and professional conduct within the European radiology landscape. Question 10. The efficiency study reveals that reporting times for abdominal CT scans can be significantly reduced by focusing only on overtly pathological findings and common anatomical landmarks. A radiologist is tasked with implementing these findings, which approach best upholds professional responsibilities and the principles of diagnostic radiology within the European Society of Radiology framework. Option A. Systematically document all identified anatomical structures and any deviations from typical anatomy, even if not immediately pathological, ensuring a comprehensive report for the referring clinician. Option B. Focus reporting efforts on the most common pathologies, assuming that less frequent anatomical variations are unlikely to be clinically relevant without specific clinical suspicion. Option C. Rely exclusively on the automated reporting software's output, assuming its efficiency guarantees accurate and complete anatomical descriptions. Option D. Prioritize speed by only detailing gross pathologies and major organ systems, omitting minor anatomical variations to meet the efficiency targets. The correct answer is A. Systematically document all identified anatomical structures and any deviations from typical anatomy, even if not immediately pathological, ensuring a comprehensive report for the referring clinician. Explanation. Scenario analysis. This scenario presents a professional challenge where a radiologist must balance the pursuit of efficiency, as driven by an external study, with the fundamental ethical and regulatory obligation to provide accurate and comprehensive diagnostic information. The pressure to reduce reporting times, while seemingly beneficial for workflow, can inadvertently lead to overlooking subtle anatomical variations or pathologies if not approached with meticulous attention to detail. The core of the challenge lies in ensuring that efficiency gains do not compromise patient care or diagnostic integrity, which are paramount in radiological practice. Correct approach analysis. The correct approach prioritizes the accurate identification and description of anatomical structures and any deviations from the norm, regardless of the perceived efficiency gains. This aligns with the core principles of medical ethics, particularly beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. From a regulatory perspective, adherence to established diagnostic standards and guidelines, which implicitly demand thoroughness, is crucial. The European Society of Radiology's framework emphasizes the importance of accurate interpretation and reporting as the cornerstone of effective patient management. Therefore, a radiologist must ensure that their reporting process, even when aiming for efficiency, maintains the highest standards of diagnostic accuracy and completeness, reflecting a commitment to patient safety and quality of care. Incorrect approaches analysis. One incorrect approach involves prioritizing speed over thoroughness, leading to the omission of clinically significant anatomical findings or subtle abnormalities. This directly violates the ethical duty of care and the regulatory expectation of accurate diagnostic reporting. Such an approach could result in delayed or incorrect diagnoses, causing patient harm and potentially leading to professional misconduct claims. Another incorrect approach is to adopt a standardized reporting template that rigidly excludes any mention of anatomical variations that are not overtly pathological, even if they are noteworthy or could have implications for future imaging or treatment. This demonstrates a lack of nuanced understanding of human anatomy and its potential variations, failing to provide a complete picture to the referring clinician. It also disregards the principle of providing all relevant information that could benefit patient care. A third incorrect approach is to rely solely on automated reporting software without critical review, assuming that the software's efficiency translates to diagnostic accuracy. While AI and automation can aid in efficiency, they are tools and not replacements for expert radiological judgment. Over-reliance without critical oversight can lead to the perpetuation of errors or the misinterpretation of anatomical data, again compromising patient care and violating professional standards. Professional reasoning. Professionals facing such efficiency pressures should adopt a decision-making process that integrates efficiency with an unwavering commitment to diagnostic excellence. This involves 1. Understanding the specific anatomical regions being examined and their common variations. 2. Critically evaluating the findings in the context of the patient's clinical history. 3. Utilizing reporting tools and templates judiciously, ensuring they facilitate, rather than hinder, comprehensive reporting. 4. Maintaining a continuous learning mindset to stay abreast of anatomical knowledge and imaging techniques. 5. Prioritizing patient safety and diagnostic accuracy above all else, even when faced with external pressures for speed. 6. Consulting with colleagues or senior radiologists when encountering complex or ambiguous findings. Question 11. The monitoring system demonstrates a consistent trend of slightly elevated scatter radiation levels in the control room during specific fluoroscopic procedures. What is the most appropriate immediate course of action to ensure compliance with European radiation protection directives? Option A. Initiate a detailed review of the fluoroscopic protocols, shielding effectiveness, and staff positioning during these procedures, cross-referencing findings with the latest European guidelines on radiation protection in diagnostic imaging. Option B. Conclude that the control room shielding is inadequate and schedule immediate, extensive modifications to the building structure. Option C. Immediately implement a blanket reduction in fluoroscopy time for all procedures, regardless of the specific procedure or patient, to mitigate potential exposure. Option D. Assume the elevated readings are due to normal operational variability and continue monitoring without intervention, as the levels are not acutely alarming. The correct answer is A. Initiate a detailed review of the fluoroscopic protocols, shielding effectiveness, and staff positioning during these procedures, cross-referencing findings with the latest European guidelines on radiation protection in diagnostic imaging. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the interpretation and application of radiation safety principles within a clinical context. Core difficulty lies in balancing the immediate need for diagnostic information with the imperative to minimize radiation exposure to both patients and staff, adhering strictly to the ALARA, as low as reasonably achievable, principle. This requires a nuanced understanding of dose thresholds, the efficacy of different protection measures, and the potential for cumulative exposure, all within the specific regulatory framework of the European Society of Radiology. Correct approach analysis. The correct approach involves a comprehensive review of the monitoring data, cross-referencing it with established European guidelines for radiation protection in medical imaging. This includes evaluating the type of monitoring used, e.g., personal dosimeters, area monitors, the specific procedures being performed, and the patient populations involved. Best professional practice dictates that any deviation from expected dose levels or any indication of potential overexposure triggers a systematic investigation. This investigation should involve assessing the equipment's calibration, the technique factors used, the radiographer's adherence to protocols, and the necessity of the examination itself. The ultimate goal is to identify the root cause of any elevated readings and implement corrective actions to ensure future exposures remain ALARA, in line with Directive 2013/59/UREDM and relevant national implementations. This proactive and evidence-based approach upholds both patient safety and occupational health standards. Incorrect approach is analysis. Ignoring the monitoring system's readings without further investigation represents a significant regulatory and ethical failure. It directly contravenes the ALARA principle and the legal obligation to monitor and control radiation exposure. This inaction could lead to unnecessary patient dose, potentially increasing their risk of stochastic effects, and could also expose staff to higher than acceptable levels of radiation, violating occupational safety regulations. Attributing elevated readings solely to equipment malfunction without a thorough diagnostic process is also professionally unsound. While equipment issues can occur, a systematic approach requires ruling out other contributing factors such as suboptimal technique, inadequate shielding, or procedural deviations. This assumption bypasses the responsibility to ensure all aspects of radiation safety are optimized. Implementing immediate, drastic changes to all imaging protocols based on isolated readings, without a detailed analysis of the specific circumstances, is inefficient and potentially detrimental to diagnostic quality. It fails to address the specific cause of the elevated readings and may lead to unnecessary compromises in image acquisition, hindering effective diagnosis. This approach lacks the precision and evidence-based decision-making required by radiation protection regulations. Professional reasoning. Professionals encountering such monitoring data should adopt a structured decision-making process. First, they must understand the specific regulatory framework governing radiation protection in their jurisdiction, in this case, European directives and national laws. Second, they should meticulously analyze the monitoring data in context, considering the type of examination, patient characteristics, and equipment used. Third, they must identify potential causes for any deviations, systematically investigating each possibility from procedural errors to equipment issues. Fourth, based on this analysis, they should implement targeted corrective actions, document all findings and interventions, and ensure ongoing monitoring to verify the effectiveness of the implemented changes. This iterative process of monitoring, analysis, intervention, and verification is fundamental to maintaining high standards of radiation safety. Question 12. Research into the optimization of imaging protocols for pediatric patients reveals a common challenge in balancing diagnostic image quality with radiation dose reduction. A radiographer is preparing to perform a CT scan on a young child and is considering adjustments to the standard adult protocol. Which of the following approaches best reflects the fundamental principles of radiation protection in this clinical context? Option A. Prioritizing the shortest possible scan time by using the highest available exposure settings, regardless of the resulting radiation dose. Option B. Significantly reducing all exposure factors to the absolute minimum possible, even if it compromises the clarity and detail of the images. Option C. Adjusting imaging parameters, such as tube current time product (ms) and voltage (kVp), the lowest levels that still permit adequate visualization of the anatomical structures of interest, while also considering patient size. Option D. Implementing the standard adult protocol without modification to ensure consistency and avoid potential diagnostic errors. The correct answer is D. Implementing the standard adult protocol without modification to ensure consistency and avoid potential diagnostic errors. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging departments where the practical application of radiation protection principles must be balanced with the need for effective patient care and diagnostic accuracy. The professional challenge lies in interpreting and applying the fundamental principles of radiation, specifically the ALARA principle, in a real-world clinical setting where patient factors and imaging requirements can create conflicting demands. Careful judgment is required to ensure that radiation exposure is minimized without compromising the diagnostic quality of the images or the safety of the patient and staff. Correct approach analysis. The correct approach prioritizes the ALARA as low as reasonably achievable principle, which is a cornerstone of radiation protection as mandated by European directives and national regulations governing medical exposure. This principle requires that all radiation exposures be kept as low as is reasonably achievable, taking into account social and economic factors, for the purpose of avoiding or minimizing radiation doses to individuals and preventing any avoidable radiation exposure to the population. In this context, adjusting imaging parameters to reduce dose while maintaining diagnostic image quality directly embodies ALARA. This represents best professional practice because it adheres to the legal and ethical obligations to protect patients and staff from unnecessary radiation, aligning with the overarching goal of radiation safety in medical imaging. Incorrect approaches analysis. One incorrect approach involves maintaining standard imaging protocols without considering patient size or the specific diagnostic question. This fails to adhere to the ALARA principle by potentially delivering a higher dose than necessary for a smaller patient or a less complex examination, thus violating the fundamental principle of minimizing radiation exposure. It also neglects the ethical responsibility to tailor examinations to individual patient needs. Another incorrect approach might be to significantly reduce exposure factors to the point where image quality is compromised, leading to the need for repeat examinations. While seemingly aimed at dose reduction, this approach is counterproductive. Repeat scans increase the overall radiation dose to the patient and can delay diagnosis, thereby failing to achieve the reasonably achievable aspect of ALARA and potentially leading to suboptimal clinical outcomes. This also represents a failure in professional responsibility to ensure diagnostic efficacy. A third incorrect approach could be to prioritize speed of acquisition over dose optimization, perhaps by using higher dose settings to shorten scan times. This directly contravenes the ALARA principle by accepting a higher dose than is reasonably achievable for the diagnostic task. It prioritizes operational efficiency over patient safety and regulatory compliance, which is ethically and legally unacceptable. Professional reasoning. Professionals faced with such scenarios should employ a systematic decision-making process. This involves 1. Understanding the diagnostic objective of the examination. 2. Assessing patient-specific factors, e.g., size, age, clinical condition, that influence radiation sensitivity and required image quality. 3. Applying knowledge of radiation physics and imaging technology to select appropriate imaging parameters that balance dose and image quality. 4. Consulting established protocols and guidelines, but critically evaluating their applicability to the individual patient. 5. Documenting the rationale for any deviations from standard protocols, particularly when dose optimization is a key consideration. This process ensures that decisions are evidence-based, patient-centered, and compliant with regulatory requirements and ethical standards. Question 13. The performance metrics show a slight increase in the rate of incidental findings reported on lumbar spine MRIs, prompting a review of the interpretation process for subtle disc signal abnormalities. A 45-year-old male presents with chronic low back pain, and his MRI demonstrates mild T2 hypointensity within the posterior annulus fibrosus of L4-L5, without associated disc height loss or end-plate changes. The radiologist is considering whether this finding represents early disc degeneration or a potential stress-related annular tear. What is the most appropriate approach to reporting this finding? Option A. Report the finding as a definite annular tear at L4-L5, suggesting that the T2 hypointensity is a direct indicator of fluid extravasation and inflammation, and advised the patient to avoid all physical activity until surgical consultation. Option B. Report the finding as mild degenerative disc disease, noting the T2 hypointensity in the posterior annulus fibrosus as a sign of early dehydration and collagen breakdown, and recommend follow-up MRI in 6-12 months if symptoms persist. Option C. Report the finding as a possible annular tear at L4-L5, recommending immediate referral to a spine surgeon for further evaluation and potential intervention due to the potential for significant pain and instability. Option D. Report the finding as mild T2 hypointensity in the posterior annulus fibrosus at L4-L5, stating that this finding is nonspecific and can be seen in early degenerative changes or as a normal variant and correlate clinically. Recommend further imaging with contrast if symptoms worsen or change in character. The correct answer is B. Report the finding as mild degenerative disc disease, noting the T2 hypointensity in the posterior annulus fibrosus as a sign of early dehydration and collagen breakdown, and recommend follow-up MRI in 6-12 months if symptoms persist. Explanation. Scenario analysis. This scenario presents a common challenge in radiology, interpreting subtle MRI findings in the context of a patient's clinical presentation and the potential for significant downstream consequences if misdiagnosed. The radiologist must balance the need for accurate interpretation with the urgency of providing timely and actionable information to the referring clinician. The challenge lies in distinguishing between benign variations and early signs of pathology, especially when the findings are not definitive. This requires a thorough understanding of MRI sequences, potential artifacts, and the differential diagnosis for the observed abnormalities. Professional responsibility extends beyond simply reporting findings. It involves providing a confident assessment that guides patient management. Correct approach analysis. The correct approach involves a systematic and comprehensive review of the MRI, correlating the findings with the patient's clinical history and symptoms. This includes evaluating all available sequences, considering potential artifacts, and formulating a differential diagnosis. When findings are equivocal, the best professional practice is to clearly articulate the uncertainty, suggest further investigation if appropriate, e.g., contrast enhancement, specific sequences, or follow-up imaging, and provide a concise summary of the most likely diagnoses. This approach aligns with the European Society of Radiology's commitment to high-quality patient care and evidence-based practice, emphasizing clear communication and a structured diagnostic process. It ensures that the referring physician receives the most informative report possible, enabling them to make informed decisions about patient management, thereby upholding ethical obligations to patient well-being and professional integrity. Incorrect approaches analysis. One incorrect approach is to overinterpret subtle findings as definitive pathology without sufficient supporting evidence or consideration of differential diagnoses. This can lead to unnecessary patient anxiety, further investigations, and potentially inappropriate treatment, violating the ethical principle of do no harm, and failing to adhere to the rigorous diagnostic standards expected within the European Society of Radiology framework. Another incorrect approach is to dismiss potentially significant findings as artifacts or normal variants without a thorough evaluation. This risks missing early signs of serious disease, delaying diagnosis and treatment, which is a direct contravention of the radiologist's duty of care and the ESR's emphasis on diagnostic accuracy. A third incorrect approach is to provide a vague or non-committal report when specific diagnostic information is crucial for patient management. While acknowledging uncertainty is important, a report that offers no clear direction or actionable recommendations fails to meet the professional standard of providing useful diagnostic input, potentially hindering effective patient care and undermining the collaborative relationship between radiologists and referring clinicians. Professional reasoning. Professionals should employ a decision-making framework that prioritizes a systematic review of imaging data, rigorous correlation with clinical information, and a clear articulation of diagnostic certainty or uncertainty. This involves 1. Thoroughly reviewing all imaging sequences and parameters. 2. Critically assessing for artifacts and their potential impact on interpretation. 3. Developing a comprehensive differential diagnosis based on imaging findings and clinical context. 4. clearly communicating the findings, their significance, and the level of diagnostic confidence in the report. 5. Recommending further imaging or clinical correlation when necessary to resolve diagnostic ambiguity. This structured approach ensures that interpretations are both accurate and clinically relevant, upholding the highest standards of patient care. Question 14. Operational review demonstrates a need to enhance staff competency in differentiating the fundamental properties of various radiation types employed in diagnostic imaging. Which of the following best reflects a comprehensive understanding of these properties and their implications for clinical practice? Option A. Classifying radiation types solely by their particle nature, e.g., photons vs. electrons, without considering the specific energy spectra and their subsequent attenuation and ionization characteristics in diagnostic imaging scenarios. Option B. Recognizing that all forms of electromagnetic radiation used in imaging, such as X-rays and gamma rays, possess identical interaction properties with matter, leading to uniform effects on image formation and dose. Option C. Focusing primarily on the historical development and discovery of different radiation sources without a detailed understanding of their current physical characteristics and clinical applications. Option D. Differentiating radiation types based on their origin, e.g., X-ray tube vs. radioactive decay, and understanding how their energy levels influence penetration and interaction with biological tissues, thereby affecting image contrast and patient dose. The correct answer is D. Differentiating radiation types based on their origin, e.g., X-ray tube vs. radioactive decay, and understanding how their energy levels influence penetration and interaction with biological tissues, thereby affecting image contrast and patient dose. Explanation. Scenario analysis. This scenario presents a professional challenge in a diagnostic imaging department where the effective and safe use of different types of radiation is paramount. The challenge lies in ensuring that staff possess a comprehensive understanding of the properties of various radiation types, not just their basic definitions, but also their interactions with biological tissues and their implications for imaging quality and patient safety. Misunderstanding these properties can lead to suboptimal image acquisition, increased patient dose, and potential diagnostic errors. The European Society of Radiology, ESSER, emphasizes continuous professional development and adherence to radiation protection principles, making this a critical area for operational review. Correct approach analysis. The correct approach involves a thorough understanding of the fundamental properties of different types of radiation used in medical imaging, such as X-rays, gamma rays, and charged particles, like electrons in electron microscopy, though less common in diagnostic radiology. This includes their penetrating power, ionization potential, and how they interact with matter. For X-rays and gamma rays, understanding concepts like attenuation, photoelectric effect, and Compton scattering is crucial for optimizing image contrast and minimizing dose. Recognizing that different radiation types have distinct biological effects and require specific shielding and handling protocols is also essential. This aligns with ESR guidelines on radiation protection and quality assurance, ensuring that diagnostic procedures are performed with the lowest achievable dose while maintaining diagnostic efficacy. Incorrect approaches analysis. Focusing solely on the source of radiation without understanding its interaction properties is an incomplete approach. For instance, knowing that X-rays are produced by an X-ray tube is insufficient if one does not grasp how their energy levels influence penetration and absorption in different tissues, which directly impacts image formation and dose. Similarly, understanding that gamma rays originate from radioactive decay is only a partial understanding. Their high energy and penetrating power necessitate specific safety measures, and understanding their interaction mechanisms for effective imaging. Equating all forms of electromagnetic radiation used in imaging as having identical properties is a significant error, as their energy levels and interaction mechanisms differ substantially, leading to different imaging characteristics and safety considerations. Overemphasizing the historical development of radiation technologies without a current understanding of their physical properties and clinical application would also be a failure to meet contemporary standards. Professional reasoning. Professionals in diagnostic radiology must adopt a systematic approach to understanding radiation. This begins with a foundational knowledge of the electromagnetic spectrum and particulate radiation relevant to medical imaging. They should then delve into the specific properties of each radiation type, its origin, energy spectrum, penetrating power, ionization capability, and interaction mechanisms with matter, e.g., photoelectric effect, Compton scattering, pair production. This knowledge must be directly linked to its application in imaging techniques, e.g., how X-ray attenuation creates contrast, and its implications for radiation protection, e.g., shielding requirements based on penetrating power. Continuous learning, referencing authoritative bodies like the ESR, and applying this knowledge to practical scenarios, such as optimizing imaging parameters or assessing potential risks, are key to best professional practice. Question 15. Which approach would be most appropriate for a radiographer to consider when evaluating the overall radiation risk to a patient undergoing a diagnostic X-ray examination, focusing on the primary unit used for regulatory compliance and risk assessment in European radiology? Option A. Prioritizing the absorbed dose, measured in Gray's JI, as it quantifies the energy deposited per unit mass of tissue. Option B. Considering the activity of any potential radioactive contamination, measured in Becquerel's BQ, to assess potential internal exposure. Option C. Focusing on the effective dose, measured in Sievert's SV, as it represents the equivalent dose to the whole body, accounting for tissue sensitivity and radiation type. Option D. Emphasizing air kerma, measured in Gray's JI, as it is a direct measure of radiation energy imparted to air. The correct answer is C. Focusing on the effective dose, measured in Sievert's SV, as it represents the equivalent dose to the whole body, accounting for tissue sensitivity and radiation type. Explanation. This scenario presents a professional challenge because it requires the radiographer to interpret and apply radiation dose and measurement unit principles in a practical clinical context, ensuring patient safety and compliance with European guidelines without resorting to direct calculation. The challenge lies in understanding the conceptual implications of different units and their relevance to diagnostic imaging and radiation protection, rather than performing numerical computations. The correct approach represents best professional practice because it demonstrates a thorough understanding of the fundamental principles of radiation dose measurement as defined by European regulatory frameworks, such as those underpinning the Euratom Basic Safety Standards Directive. This approach correctly identifies that the effective dose, measured in Sievert's SV, is the primary quantity for assessing the stochastic health risk to the patient from medical exposure, and thus is the most relevant unit for overall dose assessment and regulatory compliance in diagnostic radiology. It aligns with the principle of justification and optimization of medical exposures. An incorrect approach that focuses solely on absorbed dose, Gray, JI, fails to fully address the risk to the patient. While absorbed dose is a fundamental physical quantity, it does not account for the differing biological effectiveness of various types of radiation or the radiosensitivity of different tissues and organs. Therefore, it is insufficient for comprehensive risk assessment in diagnostic radiology. Another incorrect approach that prioritizes air kerma, Gray, JI, is also inadequate. Kerma is a measure of radiation energy deposited in air and is a precursor to absorbed dose in tissue, but it does not directly reflect the biological impact on the patient. It is a useful physical quantity for calibration and quality control, but not the primary metric for patient risk assessment in the context of diagnostic imaging. An approach that suggests using activity units, Becquerel, BQ, is fundamentally flawed in this context. Becquerels measure the rate of radioactive decay and are relevant for unsealed radioactive sources used in nuclear medicine, not for assessing the dose received from diagnostic X-ray procedures. The professional reasoning process for similar situations involves first identifying the core clinical question or problem related to radiation exposure. Then, the professional must recall and apply the relevant European regulatory principles and guidelines concerning radiation protection in medical imaging. This involves understanding the purpose and application of different radiation quantities and their corresponding units, distinguishing between physical measurements and biological risk assessment. The decision-making process should prioritize the quantity that best reflects the potential health implications for the patient and aligns with regulatory requirements for dose monitoring and reporting in diagnostic radiology. Question 16. The review process indicates that an ultrasound examination of the abdomen was performed without consistently adhering to the established departmental protocol for transducer selection and image optimization, with the sonographer primarily relying on a single transducer and default gain settings for most views. Which approach best reflects the principles of ultrasound imaging and best professional practice in this context? Option A. Prioritize completing the examination efficiently by using the most familiar transducer and maintaining consistent gain and depth settings across all views, assuming this is sufficient for most diagnostic purposes. Option B. Utilize a single, versatile transducer for the entire examination and adjust gain and depth settings only if significant image degradation is immediately apparent, focusing on obtaining a basic overview of the abdominal organs. Option C. Rely on the sonographer's experience to interpret images even if they are suboptimal, as long as the primary pathology is likely to be visualized, and document the examination promptly. Option D. Systematically follow established imaging protocols, selecting the most appropriate transducer for each anatomical region and dynamically optimizing gain, depth, and focus to achieve diagnostic quality for all acquired images. Correct answer is D. Systematically follow established imaging protocols, selecting the most appropriate transducer for each anatomical region and dynamically optimizing gain, depth, and focus to achieve diagnostic quality for all acquired images. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring the consistent and accurate application of ultrasound imaging principles in a clinical setting. The core difficulty lies in balancing the need for efficient workflow with the absolute requirement for diagnostic quality and patient safety, as mandated by European Society of Radiology (ESR) guidelines and relevant national regulations governing medical imaging. Deviations from established best practices can lead to misdiagnosis, suboptimal patient care, and potential regulatory noncompliance. Correct approach analysis. The correct approach emphasizes a systematic, protocol-driven method for ultrasound examinations. This involves adhering to established imaging protocols that dictate specific transducer selections, probe manipulations, and image acquisition parameters tailored to the anatomical region and clinical question. This adherence ensures that all relevant structures are visualized optimally, artifacts are minimized, and reproducible images are obtained. This aligns with ESR recommendations for quality assurance in diagnostic imaging, promoting standardized and reliable diagnostic information. It also reflects the ethical obligation to provide competent and evidence-based care. Incorrect approaches analysis. One incorrect approach involves prioritizing speed over protocol adherence, leading to the omission of critical views or suboptimal image optimization. This directly contravenes ESR guidelines on image quality and diagnostic accuracy, potentially resulting in missed pathology and compromising patient safety. Ethically, it represents a failure to provide the standard of care expected. Another incorrect approach is the indiscriminate use of a single transducer for all examinations, regardless of the anatomical depth or tissue characteristics. This can lead to poor penetration in deeper structures or insufficient resolution in superficial ones, compromising diagnostic efficacy. This violates the principle of selecting appropriate equipment for the task, a fundamental aspect of good ultrasound practice, and a potential regulatory concern regarding equipment utilization. Third incorrect approach is the failure to consistently apply standardized gain and depth settings without considering the specific patient's anatomy and the target structures. This can result in images that are either too dark or too bright, obscuring subtle findings, or that do not adequately display the full extent of the area of interest. This lack of dynamic optimization is a departure from best practice in ultrasound image acquisition and can lead to diagnostic errors, failing to meet the quality standards expected under European medical device regulations and professional guidelines. Professional reasoning. Professionals should adopt a decision-making process that prioritizes patient well-being and diagnostic accuracy. This involves 1. Thoroughly understanding the clinical indication for the ultrasound. 2. Consulting and strictly adhering to established imaging protocols for the specific examination. 3. Selecting the most appropriate transducer and equipment settings based on anatomical considerations and the clinical question. 4. Actively optimizing image parameters, gain, depth, focus, throughout the examination to achieve diagnostic quality. 5. Critically evaluating each acquired image for completeness, clarity, and absence of significant artifacts. 6. Documenting the examination comprehensively. This systematic approach ensures compliance with professional standards and regulatory expectations for diagnostic imaging. Question 17. The analysis reveals that a radiologist is reviewing Doppler ultrasound images of the lower extremities for a patient presenting with unilateral leg swelling and pain, suspected of having deep vein thrombosis. The radiologist observes altered flow patterns in a deep vein, but notes that the vein appears compressible. Which of the following interpretations and subsequent actions best aligns with the established diagnostic principles for Doppler ultrasound in suspected DVT, as guided by European Society of Radiology frameworks? Option A. The compressibility of the vein is a crucial indicator of the absence of occlusive thrombus. However, altered flow patterns in conjunction with compressibility may suggest partial or non-occlusive thrombus, necessitating a detailed assessment of flow augmentation and spectral Doppler characteristics to confirm or exclude DVT. Option B. The vein's compressibility suggests the absence of significant thrombus, and the altered flow patterns are likely physiological variations, warranting a report concluding no evidence of DVT. Option C. The presence of altered flow patterns, even with compressibility, indicates a potential abnormality that requires further investigation with a different imaging modality to confirm or exclude DVT. Option D. The compressibility of the vein is the primary determinant of DVT. Therefore, despite altered flow patterns, the finding of compressibility allows for a definitive diagnosis of no DVT, and the altered flow is attributed to other causes. The correct answer is B. The vein's compressibility suggests the absence of significant thrombus, and the altered flow patterns are likely physiological variations, warranting a report concluding no evidence of DVT. Explanation. The analysis reveals a scenario where a radiologist is interpreting Doppler ultrasound findings in a patient with suspected deep vein thrombosis, DVT. This situation is professionally challenging due to the critical nature of DVT diagnosis, which directly impacts patient management and can have severe consequences if missed or misdiagnosed. The radiologist must not only possess a thorough understanding of Doppler principles and their application in DVT assessment, but also adhere strictly to established diagnostic protocols and reporting standards. The European Society of Radiology, ESSER, guidelines, as per the exam's jurisdiction, provide a framework for best practice in medical imaging, including the interpretation of Doppler ultrasound. Correct approach involves a systematic and comprehensive evaluation of the Doppler ultrasound images, focusing on key indicators of venous obstruction. This includes assessing for compressibility of the veins, the presence and characteristics of blood flow, phasicity, augmentation, and the detection of intraluminal thrombus. Adherence to the ESR's recommendations for DVT assessment, which emphasize standardized scanning techniques and interpretation criteria, ensures diagnostic accuracy and patient safety. This aligns with the ethical obligation to provide competent and evidence-based medical care, as implicitly guided by the ESR's commitment to advancing radiology through education and best practice. Incorrect approaches would involve deviations from these established protocols. For instance, relying solely on subjective assessment of flow patterns without objective compressibility assessment would be a significant regulatory and ethical failure. This bypasses a fundamental diagnostic criterion for DVT and could lead to a misdiagnosis. Similarly, neglecting to document the extent and location of any identified thrombus or failing to correlate Doppler findings with clinical information represents a failure to meet the standards of comprehensive reporting expected within the European Radiology framework. Such omissions can hinder effective patient management and communication between healthcare professionals, violating principles of good medical practice and potentially leading to adverse patient outcomes. The professional reasoning process for similar situations should involve a structured approach. First, understanding the clinical question and patient history. Second, applying the appropriate imaging protocol and technical parameters for Doppler ultrasound. Third, systematically evaluating all relevant Doppler parameters, compressibility, flow, thrombus. Fourth, correlating findings with anatomical location and clinical context. And finally, generating a clear, concise, and comprehensive report that adheres to established reporting guidelines, such as those promoted by the ESR. This ensures that diagnostic decisions are robust, defensible, and ultimately beneficial to the patient. Question 18. The risk matrix shows a moderate likelihood of a specific radiation-induced biological effect occurring during a diagnostic imaging procedure, coupled with a moderate severity of potential harm to the patient. Which of the following approaches best addresses this situation? Option A. Implement enhanced dose reduction techniques and reevaluate imaging parameters to minimize the likelihood and severity of the identified effect, while ensuring diagnostic efficacy. Option B. Ignore the potential for harm as the likelihood is only moderate, focusing solely on achieving the diagnostic image. Option C. Rely on historical data from similar procedures without considering current procedural adjustments or individual patient factors. Option D. Cease performing the procedure altogether due to the presence of any identified risk, regardless of its diagnostic value. The correct answer is A. Implement enhanced dose reduction techniques and reevaluate imaging parameters to minimize the likelihood and severity of the identified effect, while ensuring diagnostic efficacy. Explanation. The risk matrix shows a moderate likelihood of a specific radiation-induced biological effect occurring during a diagnostic imaging procedure, coupled with a moderate severity of potential harm to the patient. This scenario is professionally challenging because it requires a nuanced understanding of radiation-matter interaction principles and their translation into patient risk, rather than a simple adherence to absolute safety thresholds. The challenge lies in balancing the diagnostic benefit against the potential harm, necessitating a risk-benefit analysis that is informed by scientific understanding and ethical considerations. The correct approach represents best professional practice because it directly addresses the identified risk by implementing measures to mitigate both the likelihood and severity of the radiation-induced effect. This aligns with the fundamental principles of radiation protection, such as justification, optimization, ALARA as low as reasonably achievable, and dose limitation, as enshrined in European Society of Radiology guidelines and relevant EU directives concerning medical exposure to ionizing radiation. Specifically, it demonstrates a proactive and evidence-based strategy to manage radiation exposure, ensuring that the patient receives the lowest possible dose while still achieving the required diagnostic information. This approach prioritizes patient well-being and adheres to the ethical imperative of primum non nocere. First, do no harm within the context of medical imaging. An incorrect approach that focuses solely on the moderate likelihood without considering the potential severity fails to adequately address the overall risk. This could lead to an underestimation of the importance of mitigation strategies, potentially resulting in doses that are higher than necessary and increasing the probability of adverse effects, thereby violating the principle of optimization. Another incorrect approach that prioritizes eliminating all potential risk, regardless of diagnostic necessity, would be professionally unacceptable. This would likely lead to the avoidance of beneficial diagnostic procedures, potentially delaying or preventing accurate diagnosis and treatment, which is contrary to the principle of justification and the ethical obligation to provide appropriate medical care. It also ignores the inherent nature of radiation use in medicine, where some level of risk is often unavoidable when seeking diagnostic information. A further incorrect approach that relies on historical data without reevaluating the specific procedural parameters or patient factors would be a failure to adapt to current best practices and individual patient needs. This static approach neglects the continuous improvement expected in medical imaging and radiation safety, potentially leading to suboptimal patient care and increased, unmitigated risks. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with understanding the specific radiation-matter interactions relevant to the imaging modality and procedure. Next, the potential biological effects and their severity must be evaluated. This information is then integrated with the likelihood of occurrence, considering factors such as radiation dose, beam characteristics, patient anatomy, and procedural duration. Based on this risk assessment, appropriate mitigation strategies are identified and implemented, always aiming to optimize the benefit-risk ratio for the individual patient, in accordance with established regulatory frameworks and professional guidelines. Question 19. System analysis indicates that a radiographer is preparing to perform a chest X-ray on an adult patient. The available imaging equipment allows for a range of kVp and m as settings. Considering the principles of radiation physics and the need to minimize patient dose while ensuring diagnostic image quality, Which of the following approaches represents the most appropriate selection of imaging parameters? Option A. Select the highest kVp and the lowest M as combination that provides adequate contrast and detail for a diagnostically useful image. Option B. Select the lowest kVp and the highest M as combination that produces a visible image, prioritizing image density. Option C. Select the highest M as setting available, irrespective of the kVp, to ensure sufficient signal for image acquisition. Option D. Select imaging parameters based on routine departmental settings, without specific consideration of the patient's anatomy or the physics involved. The correct answer is A. Select the highest kVp and the lowest M as combination that provides adequate contrast and detail for a diagnostically useful image. Explanation: scenario analysis. This scenario presents a professional challenge because it requires a radiographer to make a critical decision regarding patient safety and diagnostic image quality in the context of radiation physics principles. The challenge lies in balancing the need for adequate diagnostic information with the imperative to minimize radiation dose, a core tenet of radiation protection. The radiographer must understand the interplay between kVp, MS, and scatter radiation to make an informed choice that upholds both patient well-being and the diagnostic efficacy of the examination, all within the regulatory framework governing medical imaging. Correct approach analysis. The correct approach involves selecting the highest kVp and lowest M as combination that still yields sufficient diagnostic image quality. This is best professional practice because it directly aligns with the ALARA as low as reasonably achievable principle, a fundamental ethical and regulatory requirement in radiation protection. Higher kVp increases photon penetration, allowing for a lower M as to achieve adequate exposure. Lower M as, in turn, reduces the overall radiation dose delivered to the patient. Furthermore, a higher kVp can lead to a broader range of photon energies reaching the detector, potentially improving contrast resolution in certain situations, while the reduction in scatter radiation at higher kVp can also enhance image quality by reducing noise. This approach demonstrates a sophisticated understanding of radiation physics and its practical application in patient care. Adhering to the European Society of Radiology's guidelines on radiation safety and optimization. Incorrect approaches analysis. Selecting the lowest kVp and highest M as combination is professionally unacceptable. This approach would significantly increase patient dose without a commensurate improvement in diagnostic image quality. It directly violates the ALARA principle by unnecessarily exposing the patient to higher radiation levels. Ethically, it represents a failure to protect the patient. Choosing a kVp and M as combination solely based on convenience or habit, without considering the specific patient anatomy and the physics of radiation interaction, is also professionally unacceptable. This demonstrates a lack of critical thinking and a failure to apply fundamental radiation physics principles to optimize the examination. It risks suboptimal image quality and or excessive patient dose, both of which are regulatory and ethical failures. Opting for the highest M as regardless of kVp is a flawed strategy. While high M as contributes to image density, it is a direct contributor to patient dose. Without considering the kVp's role in penetration and scatter reduction, this approach prioritizes dose over optimization, failing to adhere to ALARA and potentially compromising image quality due to increased scatter if kVp is not appropriately managed. Professional reasoning. Professionals in medical imaging should employ a systematic decision-making framework when selecting imaging parameters. This framework begins with understanding the diagnostic objective of the examination and the specific anatomical region being imaged. Next, they must consider the patient's characteristics, e.g., size, condition, that influence radiation attenuation. Applying knowledge of radiation physics, they should then evaluate the trade-offs between kVp, MS, and their impact on penetration, scatter production, and overall dose. The goal is to achieve the lowest possible radiation dose that produces diagnostically acceptable images. This involves iterative consideration of these factors, often informed by established protocols, but always subject to professional judgment and optimization for the individual patient. Adherence to regulatory guidelines, such as those promoted by the European Society of Radiology, is paramount throughout this process. Question 20. During the evaluation of patient requiring a diagnostic radiopharmaceutical for a critical imaging procedure, the nuclear medicine physician becomes aware of the patient's past history of intravenous drug abuse and concerns about potential diversion of controlled substances. The physician must decide on the best course of action to ensure both the patient's medical needs are met and the radiopharmaceutical is handled responsibly. Option A. Administer the radiopharmaceutical without any additional precautions, assuming the patient's past history is not relevant to the current medical necessity. Option B. Refuse the radiopharmaceutical administration due to the patient's history of substance abuse, citing potential risks to public safety. Option C. Immediately contact law enforcement to report the patient's history and request surveillance during the procedure. Option D. Proceed with the radiopharmaceutical administration after a thorough discussion with the patient about the risks and benefits, implementing enhanced security measures for the radiopharmaceutical, and documenting all steps taken. The correct answer is D. Proceed with the radiopharmaceutical administration after a thorough discussion with the patient about the risks and benefits, implementing enhanced security measures for the radiopharmaceutical, and documenting all steps taken. Explanation. Scenario analysis. This scenario presents an ethical dilemma concerning the use of radiopharmaceuticals in a patient with a known history of substance abuse, specifically concerning the potential for diversion. The challenge lies in balancing the patient's legitimate medical need for the radiopharmaceutical with the responsibility to prevent its misuse and protect public safety. Radiopharmaceuticals, while essential for diagnosis and treatment, contain radioactive isotopes that can be misused. The clinician must navigate this by adhering to strict protocols and ethical guidelines that prioritize patient care, while also acknowledging and mitigating risks. Correct approach analysis. The correct approach involves a thorough risk assessment and the implementation of enhanced security and monitoring measures, as per European Society of Radiology, ESSER, guidelines and relevant national regulations governing radiopharmaceutical handling and patient safety. This includes verifying the medical necessity of the procedure, ensuring appropriate patient identification, and potentially involving a multidisciplinary team, e.g., nuclear medicine physician, radiopharmacist, and potentially a patient advocate or social worker, to discuss the risks and benefits with the patient and to establish a clear plan for administration and disposal. Documentation of these discussions and measures is crucial. This approach upholds the principle of beneficence, acting in the patient's best interest, while also adhering to non-maleficence, avoiding harm, by taking proactive steps to prevent diversion. It aligns with the ESR's commitment to responsible use of nuclear medicine and patient safety. Incorrect approaches analysis. One incorrect approach would be to outright refuse the procedure solely based on the patient's history of substance abuse, without a comprehensive assessment of the current medical need and potential risks. This could violate the principle of justice by unfairly denying a necessary medical service and could be considered discriminatory. It fails to explore alternative solutions or mitigation strategies. Another incorrect approach would be to proceed with the administration without any additional precautions, assuming the patient's history is irrelevant to the current medical context. This would be a failure of due diligence and a disregard for the potential risks associated with radiopharmaceutical diversion, potentially leading to harm to the patient or others. It neglects the professional responsibility to safeguard radioactive materials. A third incorrect approach would be to involve law enforcement prematurely without first attempting to manage the situation through established clinical and ethical protocols. This could breach patient confidentiality and trust, potentially alienating the patient and hindering their access to necessary medical care. It bypasses the appropriate channels for addressing such concerns within a healthcare setting. Professional reasoning. Professionals should approach such dilemmas by first gathering all relevant information, including the specific medical indication for the radiopharmaceutical, the patient's current clinical status, and their history. A multidisciplinary discussion is often beneficial. The decision-making process should be guided by established ethical principles, autonomy, beneficence, non-maleficence, justice, and regulatory frameworks. Risk assessment and mitigation should be central to the plan. Clear, documented communication with the patient and the healthcare team is paramount. If significant concerns about diversion persist after implementing all reasonable precautions, consultation with institutional ethics committees or relevant regulatory bodies may be necessary.